Hi, it's Karen here. I am talking about the spinal cord stimulator, and I am 1 week away from having the permanent surgery, the permanent implant of the spinal cord stimulator. The brand that I will be having is from Boston Scientific. I went through the spinal cord stimulator trial about 7 weeks ago. I went in for it on June the 30th, 2017. I had the trial for 6 days, came out on the 6th, and since then I did update every day until I had the spinal cord stimulator removed, the trial. And I told you all about it in previous videos. I also told you in previous videos about my chronic pain, how I've had chronic pain for 2.5 plus, almost 3 years, how I went through 2 separate back surgeries, and how basically they failed, how I've gone through pain management. I've been to 3 different pain management specialists. The third one, who I still go to, has really been a godsend. Of course, no matter how much a pain management specialist can help you, you're still in pain, and it was really time for something else to be done. And that's when my surgeon who did the back surgeries suggested I try the trial, and since I felt the trial was successful, I spoke to my doctor, the pain management doctor, and after I had it removed, and we decided to go ahead and that I should have the permanent spinal cord stimulator implanted. That will be happening next week, August 18th, 2017. I did tell you I would come back and update you and keep you informed on how things were going, so that if you are thinking of doing this, you're interested in it, you want more information, hopefully I can answer some questions you may have. The trial, when I say I felt the trial worked, if you've done any reading, you'll know that the spinal cord stimulator helps with the pain. It does not totally get rid of the pain. So I felt, they say if you have at least 50% reduction in pain while having the stimulator, that would be considered successful. And I felt it was at least 50%, if not more. I rounded it out to about 65 to 70% reduction in the pain that I had been feeling for many years. To tell you how it felt, the trial, the first couple of days you're kind of in pain from having the procedure done. Then you have a couple of days where you can see if it's working, and then it's taken out. And those couple of days I actually stopped walking with my cane. I reduced my pain medication. I take oxycodone. I reduced that by about half in just those couple of days, and I really felt it made a significant positive impact for me to go forward and have this permanent implant put in next week. Also, I was told when I had the trial done, they put these thin leads in, and I believe that the leads have 16 stimulators on it. The one that I'm going to have permanently put in, it's not 2 thin leads, it's a paddle, and I believe on the paddle there's 32 points of stimulation. And so it would be giving me even a better result. And also with the trial, the leads kind of are moving around because they're not permanently placed, and the paddle will be stationary. So what I've been told is that the permanent surgery, the permanent placement is even better. So if I could even get better than 70% reduction in pain, that will be wonderful. And that is what I'm hoping for and what I'm looking forward to. And I am kind of happy to be having it done, knowing that there is some help, that I will be reducing my pain, I will be reducing my amount of pain medication that I need, and hopefully we'll be moving on to a life with a little more promise, a little more activity, because the last couple of years it's been very difficult, in pain all the time. And I tell you, when they took those leads out and the trial was over and the pain returned, it was pretty awful. It was kind of like a tease, like a little taste of you know, not feeling so much pain, and then they took it away, and it was kind of like, you know, I couldn't wait to have it back. So I also, at the same time, I do feel like, you know, when you go and you have surgery, it's like you have something and then you fix it. And this really isn't fixing, because you're not really taking away your pain by fixing it. The stimulation masks your pain so you don't feel it so much. But unfortunately, all the things that were giving you the pain, everything will still be the same. So that's kind of like, you know, you kind of a little bit of, you know, disappointing that it's not being fixed, it's just being masked. I did go last week for pre-admission testing. So basically, you go for the trial. Once the trial's over, you set up the day of surgery. Your surgeon's office will usually get approval from your insurance company. They will call the hospital and let them know, you know, you need the surgery, it's been approved, and the hospital calls you with a date for pre-admission testing. The surgeon's office called me back and gave me the date for the surgery. I went for the pre-admission testing last week. It's basic. It's your history and physical, so it's answering a bunch of questions. It's blood work. It's an EKG, blood pressure, temperature, weight, just pretty much basic, and then signing a bunch of papers. They give you a packet with instructions and the cleanser. You have to take a shower the night before and the morning of the surgery, and that's just to help prevent any kind of infections, you know, giving you a better chance of not getting or catching any kind of infections. You know, the week before, you can't take any aspirin, you can't take anything like Advil or Aleve, Motrin or anything like that before the surgery. For, you know, a week before, you have to stop taking your vitamins. The only thing I'm allowed to take is my pain medication, and I take blood pressure medication and a water pill. Otherwise, they'll tell you what you can and what you can't take, because there's certain medications that are prone to help make you bleed too quickly, and you don't want any of that when you're going to go for surgery. So, but they'll explain all of that to you. So this whole thing began, the first time I heard of spinal cord stimulation was back in the beginning of March, when I had been going for, you know, at that point, years, to the pain management specialist, having the epidural injections under anesthesia to relieve the pain. You have them in sets of 3. And I had, I would say, more than 20 injections in about 2 years' time on pain medication. And I was looking for something else. So my pain management doctor sent me back to my surgeon and said, let's see what he wants to do. And he said, are you interested in that? And he told me about it. That was the beginning of March. That's when I got back in touch with my pain management doctor. I had to go for a psych evaluation. You have to go to a psychiatrist or psychologist, and they have to just make sure that you are okay to have something foreign put into your body, because some people don't like that idea, and just to make sure that you're okay to have that kind of a thing done. And it's basically for insurance. Once that's approved and the insurance approves the trial, you go for the trial. The trial was done on just under a slight sedation, so you're awake for the trial. I'm not exactly positive if I will be totally under for the surgery. I have heard sometimes you're totally under, sometimes they wake you up in the middle to make sure it's working. Sometimes they say that it's just done under sedation. I'm not sure, because they do have to make like an incision like this to put the stimulator, because it's a little metal thing, it looks like a pacemaker, into the top of your hip. I could imagine that I would be out cold for something like that, because I couldn't imagine feeling that. But I don't know. Have heard that they wake you up in the middle just to make sure that the stimulator is working before they close everything up. So then I went for the trial. Once the trial was done and we decided to do it, it's been like about a 7-week wait between the end of the trial and now. And I will be having the surgery next week. And I will come back after the surgery and let you, make some more videos to let you know how I'm doing, how things feel, and just to try and answer some of your questions. Please subscribe. Click below and subscribe, and write me if you have any questions that I could possibly answer for you if you're thinking about this. And good luck to you, and I will see you after surgery. Bye.